Listen up, calling for a world where everyone can hear and be heard. Imagine a world where everyone can hear and enjoy life to the fullest. But for millions of people, this is not the reality. It's not just the ability to hear that's affected, but also work, education, communication, and social life. Hearing loss is the largest potentially modifiable risk factor for dementia, and it's a slippery slope towards depression and other mental health issues. Preventable hearing loss affects more than 5 million older adults in England and costs the economy over £25 billion annually if left untreated. While it used to be considered a typical part of aging, recent studies have shown that there are lifestyle and social factors that can lead to increased risk for hearing loss. For example, exposure to loud noises at work, leisure, or at home can cause irreversible and permanent hearing damage. Shockingly, 1 in 3 men and 1 in 5 women over 50 in England might have hearing loss to the extent that they are unable to hear someone standing an arm's length away. There are also stark inequalities in hearing health between the north and south of the country, which is entirely unfair. More research is needed to identify and address preventable risk factors that contribute to these inequalities. Timely detection of hearing loss is critical for effective management. However, unfortunately, many people remain unaware that they have a hearing problem, so they do not mention it to the doctor. To address this issue, the World Health Organization advocates for the inclusion of routine hearing tests as a standard part of health checkups. Regular hearing tests can easily and quickly detect hearing loss in its early stages, when it's easier to manage and prevent further deterioration. People with diabetes are also at higher risk of developing hearing loss, so they should be having regular hearing screening alongside eye screening. With improved access to hearing health checks and support for hearing conditions, we can help everyone achieve their full potential and live and work well. The picture of hearing loss across the country is currently based on outdated information. This means that the current scale and impact are not fully understood, and therefore public spending priorities are not directed to these areas for people to get the support they need. Addressing this silent public health crisis can ensure a healthier and more inclusive society. Taking proactive steps to protect our hearing is fundamental to maintaining a high quality of life, both now and in the future. We all need to take hearing health seriously by acquiring and understanding the evidence and available data to gain better insight into the true scale and implications of hearing loss. By doing so, we can ensure that people can enjoy at least 5 extra healthy, independent years of life by 2035, while narrowing the gap between the richest and poorest. Working together, we can make sure everyone has equal access to hearing care and a better quality of life. It's time to take action and make ear and hearing health a public health priority. Join us in making a world where everyone can hear and be heard, and nobody is left behind.